Hi, everyone, and welcome. We're so glad you could join us today. As folks roll in, feel free to introduce yourself in the chat, share your name and where you're joining from. My name is Jordan Tobias, and I'm the manager of grants and programs at the Foundation for Financial Planning. I'm also joined by my lovely colleague, Rachel Roth, who's our senior director of grants and programs, and she will help guide our Q&A and close us out later in the session. And we're both really excited for this conversation on how to better support our neurodivergent clients and pro bono financial planning engagements. But before we dive in to today's topic, I want to briefly talk about FFP's mission and why pro bono financial planning matters to us. So, at its core, pro bono exists because millions of Americans lack access to quality and ethical financial advice, not because they don't need it, but because they can't afford it or don't know where to find it. When trusted guidance becomes accessible, the impact can be truly life-changing, helping to reduce stress, restore confidence, and create real financial stability. And the images on the slide represent real clients whose lives have been changed through pro bono service. So you may be wondering, how do we do this work? Well, at a high level, we connect the advisory community with nonprofit programs serving families who otherwise could not afford expert financial advice. And we do this in three major ways. So first, we help develop and fund pro bono financial planning programs in partnership with nonprofits across the country, providing grant funding, technical assistance, and other resources to ensure that the programs thrive. Second, we recruit and train financial planners to volunteer, and through our national platform called ProBonoPlannerMatch.org, CFPs can find vetted pro bono opportunities and connect directly with nonprofit programs that need their expertise. And third, we rally the profession around pro bono service through education, partnership, and awareness efforts that help make pro bono financial planning a recognized and valued part of the profession. And then moving on, so the map you see here shows where this work is happening, highlighting both FFP grantee partners and nonprofit organizations currently recruiting volunteers through our platform. And together, our nonprofit partners, or together with our nonprofit partners and CFP volunteers, we support military members and veterans, family navigating a cancer diagnosis, at-risk seniors and widows, survivors of domestic violence, and many more. And what's unique about FFP is that we've designed a system that makes getting involved in pro bono financial planning simple and accessible for both the CFPs and nonprofit organizations. So for CFPs, you create a volunteer account, browse available opportunities, and select roles that align with your skills, availability, and interests. For nonprofits, you create a nonprofit account, post a volunteer opportunity, and then you recruit qualified volunteers who are prepared to serve your clients with care. And so once the two are matched, we make sure you all are supported every step of the way. So first for CFPs, this includes our pro bono financial planning volunteer training, which is a free CE eligible course that helps advisors better serve clients with low to moderate incomes. And then we also provide E&O liability insurance coverage for those who complete our training and volunteer through our platform. For nonprofits, we offer grant funding and specialized resources to help build and strengthen your pro bono financial planning program. And you can head to our website and go to our resource center to find those resources. And then lastly, before I introduce our speakers, I want to encourage all of you all to stay connected and get involved in the pro bono financial planning movement. If you would like to stay up to date on pro bono news, volunteer opportunities, or upcoming trainings, we encourage you to sign up for updates by heading over to our website. If you're interested in supporting this work in a deeper way, you can also make a gift or a multi-year pledge. And if you work with or know of any nonprofits in your communities that could benefit from, a pro bono financial planning program, I'd love to hear from you, and you can just reach out to me directly. And now I'm pleased to introduce our speakers for today. So, first we have Dr. Christine Hargrove, who is a clinical assistant professor and assistant director of the Love and Money Center at the University of Georgia. She is a licensed marriage and family therapist as well as a certified financial therapist. Her research, publications, and clinical work focus on the emotional, relational, and financial well being of individuals, couples, and families with ADHD. Joining her is Otto Rivera, who is a CFP and principal of Mindful Wealth LLC. Otto serves on the Financial Planning Association's National Board of Directors and previously led the Neurodivergent Planners Knowledge Circle. Diagnosed with ADHD in his adult years, Otto brings both professional expertise and lived experience to his work, and he has written publications and spoke widely on the intersections of money and neurodiversity. And Dr. Christine and Otto, we're so grateful you're here and for your expertise you're bringing to today's conversation. And I'm going to stop sharing my screen and turn it over to you.
All right. Okay, can you see? Yeah, okay. All right. Thank you so much for having us. We are going to be kind of tag teaming it throughout today's presentation. We are really happy to be here. Very, very excited to have so many people who are interested in the things that we love to talk about. And we will just dive right in so that we hopefully will have some time for questions at the end. That's our intention. Um, So thank you so much for giving a synopsis of who we are. So we can probably skip this. You'll get it in the slides later if you forget. Okay, so just to review, like here's what we're going to be talking about today. We're going to be reviewing the goals, a little bit of research. We're going to be talking about a framework for understanding some kind of a across the different forms of neurodiversity, what to look for, how you can be helpful. The application of that to the financial planning process. We're going to be doing a lot of like practical, very action-oriented strategies that you can implement in your financial planning with neurodiverse clients. And then Q&A. So, we want you to be able to adapt your financial planning approach to be more accessible, to be more neuro-inclusive. Specifically, we're definitely going to be talking about communication styles, the meeting structure, planning workflows. But really all of that is so that you can really help your clients engage with their money more effectively, right? So like understanding relevant, important financial information, stay engaged with the financial planning process and follow through on the financial plans that you have worked on together. All right, research. I can info dump on this like for hours. So I'm trying to throttle it. But if you want to talk about this anymore, please reach out. So let's just get started with what is neurodiversity, right? Like a lot of people feel like it's a term that gets thrown around, but what exactly does it mean? Who does it cover? So it's this idea that people experience and interact with the world around them in many different ways. So there's an article, you'll get the link in the references there at the end. But so people perceive the world differently. A lot of it has to do, so neurodevelopmental disorders tend to be included in neurodiversity. So things like autism, Tourette's, ADHD, dyslexia, dyscalculia. There's also dysgraphia, which is sort of difficulty writing. These things are all related, or at least they kind of land in many similar places in the brain. So a neurodevelopmental difference, or in some cases, neurodevelopmental disorders, um, they develop over time and often result in sort of delays in one or more areas of functioning. Um, and I can definitely get into the diagnostic stuff if you ever want. So I'm an LMFT. I diagnose this stuff, but I wanted you to have an idea of neurodiversity. While that is a very open-ended and non-stigmatizing definition, in practice, it really tends to refer to neurodevelopmental disorders that are like a category in the DSM-5. So I'm going to summarize some research, and then I have a whole bunch of selected references, and then I would love to talk about it more. So neurodiversity, it affects the actual numbers of money. So it affects, tends to be on average lower income, lower savings, lower retirement savings. Some of that is related to often many individuals who are currently adults did not receive the level of support and sometimes diagnosis as they were children to be able to achieve the level of educational outcomes that we might see in current educational trajectory. So like things are changing is what I'm saying. But like for somebody who's 50, 55, especially if it's a woman, odds are good that diagnoses weren't made, or if they were made, the I don't know, accommodations, sometimes interventions really just weren't available to her. So that really affects the lower educational outcomes, of course, affects occupational functioning and achievement level, like lower likelihood of finishing college if you're dyslexic. That's just an example. Like this is kind of a, if A, then B thing. So low overall, like lower lifetime earnings, lower likelihood of having saved enough, which also gets to the financial behavior. So tend to see more impulsive spending, lower savings behavior, lots of late or missed bill payments, usually at a relatively low amount. Um, and that, of course, leads to a lower credit score. I could not decide if that went under the numbers or if that went under the behavior, because these things all kind of swirl around together in the same shake. So you'll see a lot of differences in financial behavior that, depending on the form of neurodiversity, may be more or less apparently connected to the neurodiversity. So, for example, if you are working with someone with dyslexia, like you actually probably have an idea of some of the things to look for, like switching letters, switching numbers. There will be always things that you're not thinking about, but and then there are other aspects of it, like greater likelihood of entrepreneurship and switching jobs if you have ADHD. If you know somebody with ADHD, if you love somebody with ADHD, that's not a surprise. But if this is not something that's familiar to you, that might be a surprise of like, why do they keep changing, not just changing jobs, but like changing their career? Um, Financial decision making. So some of this research has to do with my specialization in ADHD, but I loved this one in the Kurtz et al. 2021 article. I loved this little like line in there. It had to do with there's a big study on understanding relevant and important financial information and then applying it. So they had neurotypical and ADHD populations doing these kind of financial competencies tests, and one part involved like a case study. So they had where you were, what should Jane do based on the following information? And then they had the what should you do based on the following information? It was like the same details. And the folks with ADHD did significantly worse on the what would you do, but not worse on the what should Jane do. So sometimes, like, there are these little tweaks that have to do not necessarily, this is not an intelligence issue, but there is this gap of implementation of knowing what to do in the right moment, given your context and what you've got, the memories that you have of how your life actually goes. And then the last one, so client engagement. There is a lot of internalized stigma, and I personally find it very meaningful when I have folks on a webinar, like when I hear the numbers of how many of y'all have chosen to spend an hour with Otto and me on this topic, because I work with so many individuals with ADHD. I'm always at the International Conference on ADHD. Like these are my people. Um, I identify with them. I'm connected to them. I care about them. And what I consistently hear, and it's backed by research, it's in my references, is there is a perception there that there are not enough professionals, including financial professionals, who can actually help. So like there are financial professionals who help people, but they can't help me. And I'm always pushing to try to both encourage them to seek help and trying to make sure that there are more financial professionals who really do want to be neuro inclusive and learn what do they need to know, so they can be more effective, because I think that the heart is there, and there's a gap between feeling equipped and wanting to be equipped. And so just from me personally, and I know from Otto too, thank you so much for being here, because the client engagement is a huge barrier. And a big part of that is the perception that none of these financial professionals actually care about or understand neurodiversity, and so they're not going to be able to help me. And so you are changing that story. Okay, I'm going to give you a little high level, very quick run through of executive functions. These are relevant because everybody has executive functions. Neurodiversity, this is a framework for how you can understand ways in which neurodiversity could be affecting finances and also tailor some of your recommendations. It really helps you be curious in a structured way. So, not just like, what's wrong with you? Um, but rather like, okay, so what are the invisible barriers that are getting in your way? Not just the like immediate tactile kind of stuff, but like what's going on? Like how do I understand what experiencing finances is like for you versus for me? Because it's, if you're a financial planner, pretty comfortable with it. So I want to highlight, so everybody has executive functions, it's part of brain functioning, prefrontal cortex. But so the relative strengths and weaknesses of the seven executive functions, they do vary by person. So some people are like really, really strong in some areas and maybe not as strong in others. So that's like within person. It also can vary by context. So like this next image here is like this girl, she's at work. She looks really put together. She looks like she's, I don't know, I don't, I think I'd want to be on her side if I were in a meeting because she looks like she knows what she's talking about. But then I was hoping this is the same model that it can vary by moment, right? Because sometimes you're exhausted, you're frustrated, maybe Windows updated for the fourth time in a row. Like sometimes you have just had it. And so executive functions can really vary by person. They can vary by, context or situation. And then sometimes they can just vary by moment. You've got like, it's just been a day, or you're hungry, angry, lonely, tired. They can ebb and flow. And here are the executive functions. You'll get these on the slide. I'm just going to talk you through the important aspects of it. So this is Russell Barkley's model of the seven executive functions. I map it onto a Jenga tower because I think that makes sense. This is actually how I use it when I do either when I talk about finances or any, I just talk about really anything with ADHD with my ADHD clients. And then when I do financial therapy and financial coaching, like I bring this in and I like show it on the board. So these, just like when you build a tower, building a Jenga tower, these develop over time in order. So self-awareness, babies realize they have feet. You've kind of seen that. Inhibition is when they can stop themselves. Nonverbal working memory, that's the pictures that you make in your mind. When you have that like smell and you're like, oh, that takes me back. Like that smells like grandma's house. Those are the memories, the imaginative pictures and scenarios that happen in your mind. That's kind of where you remember music, right? So nonverbal working memory. I think about, so memories are stored in the brain, like stuff will be from way long ago. Working memory, if this were a kitchen, your memories might be in the pantry. Your working memory is the stuff you can actually work with. That's like the stuff you've gotten out from the pantry onto the counter. That's the stuff that your mind is like able to engage with. So your working memory is the stuff that your mind is manipulating. Verbal working memory, language, lists. If you've ever read a paragraph like 5 times and you can't remember what it said, or you've read it and you're like, I understand what it's saying, but I don't actually understand what it's saying. I could pronounce it, but I don't understand it. Verbal working memory is part of that, being able to hold those things in mind, those instructions. Most of us are familiar with emotion regulation, motivation, and planning and problem solving. The key thing that I want you to take away from today, and there's obviously more to this model, is that no amount, we tend to like to focus on the top three. We actually tend to focus top down. So we tend to like to put a lot of pressure on the top, as though we're like drilling down into the earth, right? We're like, oh, well, I'll help you with a plan. I will help you like set up a calendar and a to-do list. And then I'm going to help motivate you by telling you how important it is or how terrible it's going to be if you don't get this right. And then, if you get upset, I'm going to tell you to calm down, like that's overworked. And then I'm just going to be like, oh, well, they just don't want to. But in reality, like this is a Jenga tower. If there are gaps in planning and problem solving, and there are gaps in emotion regulation, and there are like huge gaps in nonverbal working memory and inhibition, like no amount of setting calendar invites is going to make this work. So I always assess from the bottom up. ask a lot of questions when we find out that there's like a consistent issue. Is there anything, are you aware of yourself in that moment, like impulsive spending? Are you having difficulty understanding the instructions or maybe holding the information in mind? We were talking about so many different numbers. Am I expecting you to just remember all of those things, like the verbal working memory? Um, and then like put in the supports. You've got to make sure that if there are any issues at the bottom, that you are actively supporting with the tailored interventions and accommodations. You've got to focus on those bottom four because honestly, like the top three, once you get the bottom four right, most of the time, like people are smart. They could often handle the top three. Like you might could support, but a lot of times it's that bottom four that like that's where you really need to pay attention to some of the recommendations that Otto is bringing in because they really do address like especially the two forms of working memory, which I think are like the dirty duo and when we've got issues, or they're the dynamic duo when things are going well. So this is the framework. Lots of things besides neurodiversity can affect executive functions, especially bereavement, anxiety, depression. But you will really see it with forms of neurodiversity. You're going to see issues with um, inhibition, working memory, sometimes emotion regulation, and then the planning stuff. Okay, now I'm going to transition over to Otto for the next section. So, Otto, I'm going to have you just tell me when you want me to change the slide, and if I need to jump in at the end of the slide before I transition, I will do that.
Excellent. Thank you so much, Dr. Christine, and hello to all. We're so thankful that you are here with us. The way we're going to do the framework for this is just use the seven-step financial planning process that the CFP board uses. So a lot of you out there are CFPs, you know these steps. So what we're going to do is try to apply all this knowledge that, and this is just a little part of the knowledge, right? That Dr. Christine has shared with you, and then apply it to each step. And even though in pro bono financial planning, we do not do the last two steps, but we think you'll find it quite empowering to know how to use this also in your personal practices. So let's just go jump on it. Let's go to the next slide. And as you know, the seven financial steps, you should know them by heart if you pass the CFP or at least have an idea. But let's go with the first one, right? Which is understanding the client's personal and financial circumstances. Okay. So the common issue we're going to see here for many neurodivergent um, individuals is that there's going to be some sort of avoidance. There's going to be um, maybe not giving all the information ahead of time, not wanting to meet. Maybe they schedule a call with you and then they cancel last minute, right? You're going to see some kind of factor like this in many cases. And why is that? Well, like even in, of course, we're going to use two terms, right? Neurodivergent, right? And also neurotypical. Neurotypical is people who are not neurodivergent. So, this happens even with neurotypical clients that we have, that simply because of the situation they're they're experiencing, or maybe their finances are not where they need to be, they feel shame of some sort and they don't want to touch it. They just rather ignore the situation. In the context of a neurodivergent person, that is certainly part of it, but also there's simply the very personal shame of just feeling like maybe they're not able to control their own lives or have more agency over their affairs. So that's one of the reasons they might avoid even contact with financial planners or financial professionals, financial therapists, um, AFCs, financial counselors, right? Also, the avoidance can maybe not, also come from the overwhelming process, right? So even neurotypical clients will find sometimes the financial planning process to be over overwhelming. There's a lot of information going back and forth. There is a lot of questions. There is a lot of moments where the planner and the family and the clients, they need to talk between them and really land on some really crucial decisions to then move forward to other more important ones. So there might be avoidance because neurodivergent people might find it a little bit overwhelming and intimidating, right? And it's kind of a fear-based, um, let's call it a more of a fear-based action, just trying to avoid the process of just jumping into their situation, trying to do something about it. Also, for understanding, their personal situation and financial situation, there's going to be some disorganization, difficulty locating documents, incomplete financial records, forgot accounts that they've forgotten about, or maybe even some debt that they haven't paid just because they forgot about it, or they just lost track of time, right? So it is quite common that for neurodivergent clients, you will encounter situations like that. And um, all these things that they're confronting, you need to be there for them with a non-judgmental mentality and go and help them. That's what they need. They're also going to have challenges with time estimation, right? Difficulty estimating periods of time. Um, it maybe they know how much they make an hour, but they don't know how much they make a year. So just making all those simple calculations, they might know some general numbers for you, but if you want to go into a more exact number, that might be a challenge, and they will need your help with that. Also, there is a negative bias, and definitely these are much better times than before to be neurodivergent, right? There's much more acceptance, there's much more awareness in our society and appreciation also. And basically, but still there's a lot of stigma, right? Sometimes people will say, oh, one neurotypical person will tell another neurotypical person that is, confused or, flustered. They'll say, oh, don't be so ADHD, right? So that's stigma, right? And of course, we're not judging anyone. We know that, we're all good-hearted and we try to do our best, right? But definitely there's stigma out there. And a lot of clients, like Dr. Christine has personally told me, are out there looking for help, needing help, but they avoid getting help because they think they're going to be judged. They think they're going to be treated differently, and they also think they're not going to get great service. So if they're not finding the financial planner or financial services partner that they're looking for, either, they keep searching or they will go ahead and just surrender to their situation and not get the services they need and the help that, they need. Let's go to the, do you want to add anything, Dr. Christine?
Nope.
Okay, let's go to the next slide. We're here still understanding the situation. We need to communicate empathy, right? That's number one, empathy. Put yourself in their shoes. Do not judge them. Communicate with empathy. Intentionally foster a non-judgmental environment. That is so crucial. Okay. And you can have your opinions, and we all have them. I understand, but at the same time, your um, you need to put their shoes when you engage with them and understand that they come from a different place in life. They see some things differently than you, and that's not uncommon. We all are different in any way, but just be really cognizant about that reality of the needing to communicate that special empathy to them. It's really important, now that we have technology, things have improved greatly for neurodivergent um, people out there. Use technology when needed, and other conveniences to make the process of collecting data easier, right? Do not, if you do taxes like I do taxes, right? And if you just give a person this folder and say, okay, just put everything here and fill this 8 pages to onboard you, it's going to be really difficult for a neurodivergent person to do that. Um, so use technology as much as possible. Use conversation and technology jointly, right? And that will help you a lot to get through to the really difficult stage of starting, right? This is the very first step. Starting is probably one of the toughest parts of this process for a person that is neurodivergent. So feel free to use the technology that you have to make their lives easier so they can engage with you. Also, break down the process into simple, manageable steps to avoid overwhelm. Okay. You know, we haven't gotten into the plan, but the idea, general idea of this is not just to give them this huge binder with all these pages of the plan. We need to, from the start of the process, break down the process for them, make it manageable, make it actionable for them so it can be effective. If not, it's not going to get implemented. It's not going to change anything. It's just going to be all a fantasy. And partner with them, right? I think this is a huge part, right? I think people, either with ADHD or persons that are neurodivergent, dyslexia, dyscalculia, I had this, I guess I still have dysgraphia. I had it when I was a kid, and affected me a lot. They're looking for a partner on their journey, someone who understands them, who's going to be patient with them, and someone who is going to help them achieve their goals. And if you partner up with them, right, you offer, to be a partner in real time, to review and organize their stuff, just take that additional time, right, and just help them out. Not just say, hey, just send me everything you got by email. Don't tell them that. Just say, hey, how about if we set up this additional time and we'll go over your paperwork. If you have this big file, just bring it over. We'll help you go through it. If you're working with a client in the other side of the country, then set up a Zoom meeting and just go over their paperwork with them. Just be present with them. That will help a lot. That shared presence can reduce friction, and the follow through, will increase, I assure you. Let's go to the next slide.
Okay. All right, I am realizing that I animated the next slide. Let me see if I
Okay,
can, come
no
on,
worries.
not doing it. Okay, there we go. I'll talk through this next slide, and I just caught the time, so I will try to speak quickly. Um, with the identifying and selecting goals, there's just a lot of difficulty with identifying goals. Some of that has to do with the nonverbal working memory, I think is really where that hangs out. Some of it is the emotion regulation and like the self-awareness of when am I happy, when am I not. But I really want to, the prioritization. So I thought about putting in the Eisenhower matrix on this one. It actually doesn't quite fit because I think a lot of people use the Eisenhower matrix and intuitively are like, oh, great. So urgent versus important. I'm going to really use this to focus on the important goals despite the urgency. But in reality, executive function leads to this kind of temporal discounting, like short-sightedness regarding time. Some of that has to do with difficulty sensing time. So, but what happens is your immediate needs capture your attention over the long-term goals. So it's not just about like recognizing that you're prioritizing the urgent over the important. It's actually like I want you to kind of, just take about 15 seconds here and go along with me so that you can feel what it's like a little bit. So like let's say this llama, I think it's a llama. Uh, let's say it bites and you're standing like 8 feet away from it. Like you're pretty focused on the llama. So if I'm like, okay, but where are you going? You need to know where you're going. Like, this is really important. So then maybe I give you like a little bit of a longer term view of like your future of where you're trying to go, but it's really out of focus. So it's vague, it's abstract. Like you kind of actually have an idea, but it's little, you're like, but I don't really know. You're still going to focus on the llama. That llama bites and it does not look like it's real happy about being around you. So you've got urgent things that are actually urgent, unless you know how to fight a llama, which I don't. But then if, the long-term goals right now in this one, they're feeling really distant, abstract. You kind of don't care about whatever's over there besides what versus what's in front of you. But then if you do get some clarity, right? Now it's looking pretty interesting. Now you're like, well, if I can just get past this llama here, I'm going to be able, you're actually starting to plug into what the future looks like for you because that's a whole lot more interesting. So the prioritization of long-term goals isn't just about like understanding that you should prioritize long-term goals. There's also this emotional regulation issue and this like nonverbal working memory of like it's really hard to connect with something that feels vague and abstract. So it also is difficult. So you can do a lot of that picture painting with your work because you are good at this, identifying the next steps and then like who does what and when. And those are straightforward, but there's a lot of times where you will assume that they understand what you are meaning and they're hearing it. But then later, if they had to go and like draw it out themselves, actually, I have some questions, is going to be how they feel in. So um, I'll take a couple of these, Otto. So I had put use motivational interviewing. We're going to be sending out a handout. I'm going to send you some good resources for this. But this is the ORS part. So open-ended questions, affirm the responses, reflect back, and summarize. And that's actually amazing. This externalization of self-directed speech, giving somebody the opportunity to talk through what they think they might think. And then you can be that person who just kind of summarizes. You're not summarizing in like a preachy way. You're just summarizing, okay, it sounds like da 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 da. And then, write it down on a post-it note. All of these different potential goals that they are thinking about, like you can be the one to take notes and put it where they can see it too, because they might be like, man, I've talked about like 12 different things. I can't quite remember what the other goals I talked about were by the time I get to the last one. If you've got it out like here on this little glass thing, um, it's so much easier. People feel so much more competent and less embarrassed about the working memory when it is put somewhere where they can just look at it. They don't have to try to hold it all in their minds. You want to take it, Otto?
Yeah, no, absolutely. And wholeheartedly agree with all that Dr. Christine has said. Just get curious about your client. Really get to know them. What makes them tick? What motivates them? What is the best way of communicating with them? So I think a really important thing to know about your client is how they learn, how they communicate. Um, some people are more visual. Some people just use their hearing more to learn, or writing and um, reading and writing. Some are kinesthetic. It doesn't matter, but get to know that. Just get that context so you can communicate effectively. Not everyone is going to be impacted the same by an email communication, for example. Or if you have a risk questionnaire, right? So maybe if you have a client with dysgraphia, right, which is struggling to write, and you have all these ideas and you have all this knowledge that you want to transmit and all these messages and all these thoughts, but it's really difficult to put pen and paper or just even use the keyboard, or it takes about an hour to put an email together, right, about a complex subject. So in those cases, then maybe instead of just saying, okay, here's a questionnaire, just um, do what you must. Just say, hey, do you want to fill the questionnaire together? And of course, in an unbiased way, without putting any kind of bias in the client. Um, Basically, go over the questions, ask them. If they ask for examples, give them examples that they will understand so they know the decisions they're taking and they can visualize the goals that they really want and what it's going to take to get those goals achieved. So that's really important. Go with the energy is really important also. There's going to be things that are going to be priorities in planning, and definitely we should try to steer our clients that way. But at the same time, do have some discernment in in the way of knowing what makes your client tick, what makes your client move forward, take action, and maybe get them some victories um, at the beginning so they can get traction and then they can handle more challenging stuff for them. And narrow focus for goals. Maybe there's 20 goals that this person really needs, right, to achieve with all the things that they want to do. But focus on the most important, the most actionable, crucial goals that um, you can start working on right away. And if it could be one, two, maybe three, but one and two, just get those victories in there, and that will empower the client to move forward and then do better in the process going forward. Let's go to the next
Yeah.
slide. Okay, so analyzing the client's current course and potential course of action, and this is basically analysis that we do with a client, right? And we look at what they have been doing and what are they going to, if we need to change course. In many cases we need to, in many cases we don't, right? We know that from practicing financial planning. You know, just understand this for neurodivergent clients. There might be unawareness, right? So the client may be unaware of any current actions uh, they're actually taking, right? So maybe they think they're not saving for retirement, but they work for, they have their employer. Their employer have the opt-in, as most 401k plans and retirement plans have that nudge opt-in of saving 7 point or whatever it is now, right? I think it's gone up a little bit. And they haven't been looking at it. They see the paycheck, they know the money they're getting, and they think they're not saving for retirement. And then you go and check their account, and then they have a good portion saved. Maybe it's not invested correctly. Maybe you need to work with them with that and put them on some good investments. Um, but then they might be unaware of that. So do understand that, and maybe there's many other things that they've been doing that are correct actions. So make sure you come from a non-judgmental place and know that they might or might not be aware. There's also limited actions, right? Limited number of established actions assistance currently in place. Maybe they've tried to do a budget. Maybe they've tried to do some kind of planning before and they have implemented some, but not everything. So come with the assumption always, and the presumption that they're competent, that they're interested, and they can do this. Okay. In confusion, their current approach may appear unstructured to you or in disorganized, and you will say, well, what's this? But to them, it probably makes sense for their life. And what you're going to do is just go into their world and try to help them out. And if there's things that can be improved, absolutely, you'll work with them. And if there's some things that do work for them and are things that, it's just working for them, right? Then you're going to leave those alone. Their current plan approach may result, on other personal preferences, limitations, goals, and unrelated financial, unrelated financial planning goals. So every life is different, right? So, for example, I am not a very handy person. I think you can tell that from just seeing me. But in any case, um, I'm not the guy who is every Saturday just working on his car and doing all these things, and he has, the garage all pumped and all that. No, I'm not that kind of guy. I do have some tools, and when my wife asks me to do stuff around the house, absolutely, I'll do it. But if you see my garage versus the garage of my neighbor, who is a person who's very handy, who is into cars, into fixing, into home improvement, he has a, part-time at Home Depot probably, right? Then there's a huge difference in preferences. His goals and his way of seeing the world are very different from me. I'm not saying they're not important. I'm not saying maintaining my car is not important or maintaining my house, my AC and a working just keeping up with it so it can work properly. What we're saying is everybody is coming from a different place and you need to be open for that. Do you want to add something, Dr. Christine?
No, I think this is a perfect segue, and I will own the beginning of the slide. So I chose the graphic. There's a thought there. So in addition to assuming the client interest in like that they want something good. So Otto, you did a great job of voicing like people have good intentions. Also, what have you already tried? That is, I always include that. That's from solution focused questioning, which is a great model for financial planning. So the toilet paper, just because you see a mess does not mean that they haven't been trying to address it. It might mean that they feel like they ran out of options and that's why, or tools, and that's why they're maybe not currently doing anything about it. So just because somebody is, maybe taking a step back from their finances, maybe they have like a good enough mentality that maybe you don't feel like is good enough. They may feel like, look, I sort of ran out of toilet paper on this one. I ran out of options. I ran out of capacity. And like either somebody brings me some more, um, or like I'm just going to kind of hang out here. And then, when people are in that mode, don't just assume like, oh, well, they need to realize how important it is to clean this up. Like they know people are not dumb. Um, People are feel confused, people feel alone, people feel like they're not sure what sources of support they have. And people are often really embarrassed about being in the situation that's frankly like really relatable. So it's really important that you have this assumption that the client is trying, the client has tried, and the client is interested in trying further. And that when you engage in this, the solution part of the process, like include them in it. So as you're brainstorming potential options, like honestly, anything that comes out of their mouth is going to be way more impactful as an option and way more motivating than anything that comes out of yours, even if you think of it first. So if you have the ability as you're brainstorming, like leave some space. This is both from solution focused and motivational interviewing modalities. Leave space and see if they come up with some good options. And when they do, you better rubber stamp that, cheer it, be like, that's a great option. Where'd you come up with that? I'm totally behind it. And then, and this gets to the non-stigmatizing language. So there's still this like inner stigma of I should be able to do things the neurotypical way. So present things as experiments rather than like, okay, so here's what you need to do. Because what'll happen is as they try things and maybe that approach doesn't work for them, it just doesn't work for them. It's not that it should. It doesn't matter if it should or shouldn't. Like if it doesn't work for them to like do mental math at the grocery store every time, like it doesn't work for them. So experiment, it takes the pressure off. So as you're looking at like that executive functioning tower, if they get into that freeze mode, um, you need to be finding ways to reduce the emotional dysregulation. And one of the fastest ways to help someone calm down is to encourage curiosity. Um, Otto, I'm going to go to the next one. I'm trying to be conscious of time. Is that okay?
Yeah, yeah, no, absolutely. Yeah, let's move forward.
Okay. Um, I will, I'll read through this because I think this is actually not as interesting as the solutions that I want you to talk
Right.
about. So, obviously, not all neurodivergent clients are alike. Like, we're just not. Some people are amazing at one thing and not great at another. And then you've got like the different presentations of the different diagnoses, even within ADHD, which is kind of my baby. There's like inattentive, hyperactive, impulsive, and then there's a combined. Like, there's a lot of differences. So just be aware. Don't be like, oh, well, I've met one person with ADHD. Like, how wonderful for you. They're probably amazing. You're probably your favorite person. But like, that doesn't mean you've met everybody. You'll also see with developing the financial planning recommendations that there's going to be like, whoa, there's a lot of options here, and we're going to get analysis by paralysis. So you look at all these boats, like there's a lot of boats. They've all got different stuff on them, and there's not enough room for them to get out like on that river. And like, how do you even figure out which one needs to move first? So you can get stuck. These are common issues that happen during this stage of the financial planning process. So here's what we recommend. All right, Otto.
Yeah. So what solutions? Okay, tailor your recommendations to the unique needs of your individual client. And you may think you're already doing that now, for all your clients, but just be additionally aware that for a neurodivergent client, this is going to go even further, right? And there's even additional layers to this. There's cultural considerations also that need to be taken into account. So be aware of that. Streamline, just present a few clear choices. Just make it as clear as possible so they can take action. That's really important, and things that, not all friction will be eliminated from the process. We know that. We know that finances are like that. But try to find ways that make the action in the for the plan, the easiest possible. Make it visual, clearly illustrate the differences between options, right? So sometimes it's really difficult for neurodivergent people to, if you tell them verbally something, to just make the distinction between sometimes very alike things, like we work, right? We work with retirement accounts. There's different kinds of retirement accounts, but sometimes the differences between them are nouns and are complex. Just try to look for illustrations, allegories, examples that will make that information as clear as possible for them. Plan for overwhelm. So consider, when you do this plan, you need to understand that they might get overwhelmed. So have that in mind and just put it as simple and as anti-overwhelm as possible. The information you put in the plan, the next steps, just design a plan uniquely for them, right? That wouldn't be confusing or overwhelming. Let's go to the next slide. Presenting, common issues. You want to talk about this, Dr. Christine, or you want me to take it?
This one's pretty straightforward in some ways,
Yeah.
except for like, how did my graphic make sense? It made sense at the time. It is abstract of like this stuff kind of fits together, but like where do you start is kind of what I was thinking. And that's kind of how it feels when people get the financial planning recommendations is like this is a lot and I'm struggling to make sense of it and it looks like it's all happening at the same time. So what do I do with that?
Right. So, for example, meetings, right? So maybe you need shorter meetings for neurodivergent clients, right? And just focus on one or two things instead of
Hmm.
doing an hour and a half or a 2 hour meeting and just going through all the binder and feeding them all this information, right? Um,
Yeah,
make it relatable, not too abstract, just connecting goals. Um, let's see, shorter timeline that we have it, make it visual, the meetings 30 to 45 minutes. Do phone check-ins. If you use Loom, you can do video check-ins. That will be a great way of reaching neurodivergent clients and helping them. And be a focus guide, focus on the most important recommendations and guide clients using a clear step-by-step thing, right? Just go, okay, first we're going to do this and we're going to get it done. After we finish that and we're victorious doing that, then we'll move on to the next and so on. Let's move to the next
very
slide.
good.
Implementing, right? So we know that in pro bono financial planning, like we said, we don't do implementing or monitoring. But for your private practice, let's talk a little bit about what you can do. So for implementing, common issues, and do let me know, Dr. Christine, if you want to jump, but overwhelmed, just clients
Mhm.
feel overwhelmed. They got this beautiful plan and they're motivated, they want to get it done, but that doesn't mean that they are not going to feel overwhelmed by all the information that they have received, or all these things that they know that they can achieve now, and they have the capacity to. That can feel quite overwhelming to them. you know there's going to be obstacles on the way. Like, every client has obstacles, and they might lose momentum, lose motivation as obstacles start coming up, right? If they need to do, for example, if they have these old um 401k plans from years ago that they haven't moved into their current plan or into an IRA, calling Fidelity and calling, well, just at Fidelity, but calling Schwab or calling all custodians out there. Cannot mention all names, right? But might be a little bit challenging, right? It might be complicated. Then they'll have to talk to the rep, explain where to send the check, doing all these steps. I personally have the tradition of helping my clients directly with that, just being on the phone with them on a conference call, helping them out so they won't be overwhelmed with that. Um, and then clients may feel alone or lonely when working on their own. Just, you need to be there for them, right? So maybe more meetings, Loom videos that you can send them, calls, and just offer to do things with them, right? In the world of ADHD and or the emergency, body doubling, right? Which it means that people with, for example, ADHD tend to perform better if they have someone right by their side, helping them, or at least just being there looking at them. But that just having them on their visual field motivates them to get stuff done. So things like that will help. You want to jump in, Dr. Christine?
Yeah. So to tie this back to the executive functioning tower, which I know I haven't referenced a lot in this, but um, so small, manageable micro steps, that's verbal and nonverbal working memory. The body doubling is actually the nonverbal working memory because your brain is cueing that somebody else is doing this. And so like it helps you get in the mode more easily with less difficulty. I wanted to include planning that they're going to feel stuck or confused. So this gets back to normalizing this. Some of it has to do with verbal and nonverbal working memory. Honestly, some of it has to do with emotion regulation too, right? Because I cannot tell you the number of times that I've had a client who was like filling out a form. It gets all ready. You're worried that you're going to mess it up. It's got official government sounding language and it's very intimidating. And then you're like, I can't remember if this is true or not. I don't understand. I'm pretty sure I'm going to jail if I check the wrong box. And it's like basic tax stuff or a basic form. And so if they've already thought through whether they might be able to call you in your firm, maybe you've got like a junior associate who can be that help desk. Maybe you've identified they have a trusted contact that they've already like, hey, Joe, can I call you if I freak out when I'm filling out this form? And don't make fun of me. I just need somebody to like talk through it with me. If they've got a trusted contact, or like FAQs, resources, maybe on your website. But there's a lot of intimidation with government or official sounding language. Some of that is like, again, verbal working memory, but it really cues up. The anxiety goes like sky high. Um, and then I think this is our last section before we switch to the questions. I wanted to share the issues on this one. So I have this like running monitor. So we see these like common issues of like lack of consistency, lack of monitoring, loss of interest. And so like you're kind of thinking, okay, monitoring progress and updating. And again, this may not be for your pro bono clients, it may be for your private practice clients. But if you think about like if you are in charge of uh, organizing like the Boston Marathon, where do you put the water? And I know we don't have time to have people actually chime in, but I usually like to ask people to think about it. Like really think about where the water should go. Like, do you just hand them, getting back to what Otto talked about at the very beginning, do you just hand them 2 gallons of water, like mail it to their house 2 months before the race and say like, okay, good luck, figure it out? Like, of course you don't. You put it at regular intervals next to the course where it's, oh, somebody did chimed in. Thank you. Every few miles, small sips. Like you have to think about as you are monitoring progress, what will they need? When will they need it? Not stigmatizing that they should be able to anticipate all their needs doing this thing that maybe they've never done before. They've never done Heartbreak Hill before. They don't know. They don't know. So like, but you do because it's your job. You're an expert. You do this all the time. So as you're monitoring progress and updating, whether it's like the Loom videos, which is a website where you can create these little clips and send it to them of you like navigating a website or just you personally talking to them, encouraging them, like, and frankly, like some of the progress that they're going to need these regular check-ins, normalizing that it's hard. I actually had a friend who was an EMT who always worked Heartbreak Hill, incidentally. And so being that source of positivity, celebrate every single effort, not just the outcomes. Um, you should be the one who, if at all possible, and especially in private practice, see what you can monitor, see how many check-ins you can own, and then use that automation, use tech, text messages. I have a lot of neurodiverse clients who very don't like talking on the phone, but they do like texting. So you can do that and stay really connected. Otto, is there anything before we go to questions you want to add?
No, I know that's all fabulous. And for the texting, for those who are worried about it, there's applications out there to, for compliance reasons, track your texting and all those things for,
Cool.
financial planning. No, let's move to questions.
So we have our LinkedIn. Just look us up. This is probably the quickest way to get in contact with us. You can look up Otto's private practice. You can find me on the UGA websites as well. But we'd love to hear from you. Love questions. We love talking about this stuff, obviously.
Thank you both so much. This was so interesting and so relevant, not just for financial planning clients, pro bono and paid, but for family members, friends. So I really want to thank you for being here today. We have a lot of questions. We might not get through a ton in the time we have, but we can go over by a few minutes if you have the time. The first question that was asked is any resources for substance abuse disorder in a person with neurodiversity, since many times clients are managing both.
Yeah, so resources, that's an interesting one. I may have to go look. I would say the number one bit of advice, though, is that so yes, ADHD is associated with a higher likelihood of substance use. It actually varies a little based on which type of substance. But I'll tell you, it is difficult, if not impossible, to be in recovery long term without treating the ADHD. Usually, first line of treatment is medicine. And so, if you know someone who is in an outpatient or inpatient program and they say that they can't take their Adderall or Ritalin, good luck, because the research is overwhelmingly supportive of continuing to treat the ADHD while engaging in like rehabilitation services for other substances that are not like prescribed by a doctor.
Thank you. And the second question is, can you discuss some of the common moments where neurodivergent people are seeking financial advice, like in terms of things like overwhelming debt, death of a parent or spouse? So like in terms of presenting services differently in line with what's really desired by this population.
I would say fights with spouse would be number one. In terms of like you have to get this under control or else maybe not like immediate threat of divorce, but like it's a problem. Um, Past that, like that's definitely the biggest one. Sometimes I hear overwhelming debt, but I actually hear like the minute that people realize that someone actually knows what they're talking about and isn't going to embarrass them and can work in a different way, like they're signing up. So like it's not always a pain point that is a life transition that brings someone with ADHD or other forms of neurodiversity into the financial planning or coaching or counseling process. It's often like the need has been there the whole time. The pain points have been so chronic that the minute that there's an opportunity that they think is an actual opportunity of somebody who really cares about this stuff and might care about them as a person, not just as someone who will yet again fail to meet neurotypical expectations, like they're calling you.
One of the questions relates to someone who has a client who is having a hard time seeing the purpose of saving for retirement. Like it's very blurry what's going to happen in the future. It's too far ahead. Do you have any recommendations for how to help the client understand that this is something that's important and to like see it?
Yeah.
I do. I have two. And then Otto, I know I'm taking over here.
No,
Sorry.
no. Go ahead, doctor.
Okay, so the first one, so prospective memory is what you're talking about. And that actually is a bit of a, it's more difficult, but it's a bit of a mirror image of like regular memory. So the more that we can connect past memory to current self, the more that we can connect future self to current self. And so what I will often have clients do is like, if there's a behavior that they want to change, I don't know, they need to put a document away or they need to put their keys by the door, talk out loud. So the externalization of self-directed speech, talk out loud as you are your future self. You're like, I'm putting my keys by the door. And then for you, future Christine, and then the next time you go get the keys, you're like, thank you, past Christine. They're exactly where I need them. And like actually talk to connect past self and current self. And that will start to lay this connection between selves across time, past, present, and future selves across time. It's much easier to picture your future self when you've actually gotten in the habit of picturing like Christine needing keys tomorrow. And like that actually happens. And the self-directed speech is really important. There's reasons why for brain development, but have people talk out loud to themselves. Second, Otto and I were talking about this. Use so many visuals. Like get a whole slide deck. I wish people did this. An entire slide deck, beach, mountain, family together, big family dinners, sitting by yourself on the couch with a cup of tea. Do you want a dog? Like, don't just talk about it in theory, but like almost like a vacation menu with pictures, like this too could be yours. But don't just have it be like fancy stuff. Have it be things like a clean home or like not feeling stressed out, not feeling rushed. So get pictures of somebody who just looks chill. And like what do they gravitate toward? What do they really want? Because a lot of times it's like, it's not that somebody wants to be miserable in retirement, it's that they're having trouble thinking of a picture other, like they're thinking of the llama. And so like you need to actually paint the picture and in some cases like show pictures to help them see it, not just be like, you need to trust me, Machu Picchu's back there. It's way cooler than the llama. Like bring in, like figure out a slide deck for it.
One more question that has come up a few times, but before then, just one piece of housekeeping. Jordan and I have put it in the chat, but just a reminder that we report CE credit directly to CFP board for you. If you're an AFC, you need to report the code FFP23 yourself to AFCPE to get CE credit. So check out the chat for what I just said if you didn't catch that. The last question is regarding overspending. We've gotten a few questions related to overspending, people having clients that experience a lot of overspending. Like what guidance or recommendations do you have to help with neurodivergent clients who may fall into that category?
I want to hear from Otto too, but I would say I almost always encourage my clients to work with an app or something else. Like I like Monarch. There's a lot of different kinds out there. But what happens is clients are looking at their bank accounts, which is very much like a cash basis. But life happens more like accrual. And so being able to have some kind of budget or particularly forecasting app where they're mentally anchoring to numbers that are accounting for future needs. And you can help with that. Like that's a huge way that you can support clients in the difficulty with forecasting. But part of that needs to be that they're not just logging into their bank account and being like, oh, I have $5,000, but 4,995 are for taxes. But like I forget about that when I'm anchored to that number. So anchored to a different number other than the bank account.
Absolutely. And I would say, technology, absolutely use all the technology that you can. Automation, you really, if they want to master budgeting in the long term, I think that's a great goal. But immediately you want to save the ship, right? You don't want to come crushing down, right? So automate, use technology as much as possible, reframe concepts. For the previous question about the retirement, what I would say is just reframe it. Don't talk about retirement. Talk about financial independence. Talk about becoming rich. Those are goals that would be, I would say, I would assume your client would classify as closer in time, right? Becoming rich, having money for, living a comfortable life. So, and those things are, they preempt, having a good retirement. So just try to move the goalposts closer, right? Reframe from retirement to just financial independence, becoming rich, having options, things like that, right? And that will probably get you a better outcome, in my opinion.
I like that. Good advice, Otto. You should do this for a living.
Thank
Um,
you both.
there's some slides,
Oh, go
some
ahead. Okay.
recommendations. No, there's just references just for the recording. They exist. I'm happy to send, I mean, the slides are coming out, but that way you know.
Thank you so much. As a reminder, we're going to send the slides and the recording out later this week or early next week. And just thank you. Thank you to Otto and Dr. Christine and all of you for being here. And, even staying, we have over 200 of you who have stayed past the official end time to listen to questions. So I think that means it's been successful. And just thank you so much.
Thank you. Thank you. And if anyone had any questions, just connect with us on LinkedIn and ask the questions to the chat, and we'll be happy to answer them. Okay.
Yep. Thank you so much.
Have a great day. Take care.